From Studio 3C in Rockefeller Center, this is News 4 New York.
Well, as we know here, the Omicron variant has a lot of people rethinking those New Year's Eve plans. Health officials say that rapid tests are the key to any sort of gathering. Want to bring in Dr. Ayman El-Mohandes, Dean at the CUNY School of Public Health, joining us now to answer a few of our questions. We thank you, Doctor, for joining us.
Thank you, Natalie, for having me, and happy holidays.
Happy holidays. Happy almost New Year. Okay, a lot of people, we've been talking about the at-home tests. They've been scooping them up. Several cities, including New York, handing them out, even sending them home to students as well. And we've seen some concerns about their accuracy. Give us your thoughts on that.
Well, first, I can tell you briefly that having rapid tests sitting on your shelf does not protect you from COVID. Having them available to the people that need them, that have symptoms, that want to monitor themselves that particular day, is how we protect each other from COVID. So hoarding them is not the way to go. Sharing them with those that need them most is the way to go. That's number one. Number two, they are more accurate than nothing at all. And their turnaround time reduces the quarantining time or the guest time for somebody that needs to know right away. So their accuracy is adequate and very appropriate for their use.
Okay, second question here. As we've known for days now, there's record high COVID cases in our specific area. Hospital systems, as we just reported off the top of the show, in New Jersey, close to the brink. How concerned should we be about the surge here?
I think we should be concerned in the sense that we should monitor our own behaviors, continuing to wear masks, making sure that we are boosted, and making sure that if we have symptoms, we stay home, test ourselves with these new test kits, making sure that we're not positive. This is the only way we're going to prevent the spread. Luckily, in New York today, the number of cases or the prevalence of the cases compared to a country like Denmark is only 1/4 what Denmark is seeing. But I'll tell you where they went wrong, which is they threw caution to the wind in the month of September. They stopped wearing masks. They behaved like nothing was wrong. And what happened was, by the time they went back to their communities and said, no, start wearing masks again, it was too late. We don't want to do that. We want to stay cautious, and we want to monitor our own behaviors and behave responsibly towards ourselves, our families, and our community.
Behaving responsibly, that's such a big one here. And last question here, we have seen a rise in the number of children hospitalized. I know as a parent myself, I'm concerned about that. So to your knowledge, are those immunocompromised cases, or are we talking about perfectly healthy children here?
We are seeing healthy children get sick and needing the hospital. That is very concerning. The number of kids that are now reported amongst the cases represent 20% by the American Academy. So continuing to live that myth that COVID is not dangerous for children, we shouldn't worry, is really not panning to be true. And now we have a vaccine for the kids between the ages of 5 and 12. Please have your kids vaccinated. Please protect them. They're going to be in class again very soon, and we want the classroom environment to be safe for them and for their friends.
All right, Dr. El-Mohandes, thank you so much for joining us. We truly appreciate it. There have just been so many questions every single day, so appreciate you joining us, and Happy New Year.
A pleasure, and Happy New Year to you too.
Thank you.